It's time for our external partner panel. So for those that we've brought in, would love to invite Sean Christensen, Tammy, Jason, Sharon, and Linda to join me up on stage. All right, so I asked the team to build a little bit of time into the agenda to embarrass our partners a little bit, especially those that were with us early in the response, and to truly say thank you. For those that, Sean, Tammy, Jason, that were really part of the early and often and continuous supply chain calls to stabilize what we needed in America the most. And for all the things that you've done, truly thank you for what you've done, and thank you for being here. Thank you for continuing to be a part of the solution, and for your continued partnerships and collaboration. So, all right, I got to get my cheat sheet out. So, question time. We're going to start with Tammy. So the question for Tammy is, how can the FDA leverage government partnerships to enhance supply chain resilience in the medical device industry?
Well, first of all, thank you for having me. It's a real pleasure to be here, and thanks for always being part of that solution, Joe, and working together on so many things over the last few years. And thanks for that question as well. So, where I'll start today is it's about the FDA leveraging, but it's about all of us leveraging our capabilities, and it's about all of us leveraging our partnerships. And what I'll say is for the government folks, it's really important for us to understand what the roles of each agency are, and the expertise at each agency, I think, and how we bring together that expertise like we did during the public health emergency, and how we opened those lines of communication and processes that were established to really drive and help to start thinking about, obviously we were responding to things, but how do we now use this in a post-pandemic public health emergency world to start thinking about developing resiliency. So from an FDA perspective, we have a lot of expertise that sits within the agency, but we have, our own authorities, we have our own capabilities, and we work within that. So understanding what we bring to the table, and then how we work with other agencies like ASPR and others to help drive that resiliency in the future is going to be really important. So I think, what I would like to say first is, FDA brings a lot of the, we have medical device expertise. We stood up a new supply chain program during the public health emergency within CDRH for medical devices, so the Office of Supply Chain Resilience. We have a lot of outreach and relationships with our partners. But looking at, supply chain and how to leverage, again, across departments, I think it's really important that you realize that, FDA does have a certain level of expertise. We bring together data that we have where we can look at manufacturers in a certain space for devices. We can look at market share. We understand the clinical use. And we have kind of visibility across that, medical device manufacturing process to include even where those devices are sterilized as well. And so bringing all of that together, and we used this many times during the public health emergency, our expertise was used to inform when there would be a clinical impact, from a vulnerability or a shortage. Moving forward, when you're talking about resiliency, we need to be able to work together to identify what those vulnerabilities are, and then how we use the expertise, at FDA, but to work with IBMSC, to work with SNS to help inform policies, to inform investments, how we work with other agencies to inform just in general across the board. We did that with our impact assessments when Paige and Kyle and the DPA office, we all worked really closely together so that we could help folks understand what the downstream impacts of that might be and what the clinical impacts of a shortage are. So as we move forward, I think it's really important for us to think about each in our respective roles and leveraging the expertise within the departments, within the different agencies, and the data that they bring together and to the table to be able to proactively, and this is something we talk about a lot in our program at FDA, visualize the vulnerabilities and the risk, whether that be from some future public health emergency, a natural disaster, or whether that be from How do we domestic-based manufacturing, allied manufacturing, how do we shore up the supply chain, not just for finished devices, but also for those raw materials and components that go into those devices as well? And how do we help advocate as a unit across for a device industry that might use, 2% or 1% of a raw material or a component that the automobile industry may have, obviously the major market, or the iPhone industry like semiconductors. So just using those as examples and what we've learned, I think it's going to be really important for us to, and I'm excited about working with IBMSC and working moving forward to really think about how we bring those different data pieces, components, expertise, and our outreach with our industry, our communications with our industry to understand what their challenges are and seeing those early so that we can intervene and build resiliency in places where we currently have vulnerabilities. I'll leave it at that.
Jason, over to you. Can you share your insights on how interagency enablers and commerce can work hand in glove to address real-time supply chain challenges in the industry?
I can and will. Thank you. Good afternoon, Jason Bolton here. I'm with the Bureau of Industry and Security. And for those of you not well acquainted with the Commerce Department, we're one of the smaller bureaus, but really the lone tip of the spear. We're kind of the national security asset within the Commerce Department. And I'm grateful to be invited today and to have been enrolled over the past few years with ASPR and its leadership in a joint operation of sorts to address industrial-based risk and to bring data to bear, robust, high-fidelity information, genuine business intelligence to policy. So that's the lane I occupy. For the past 4 years, I've been acting division director for an outfit that is responsible for a mandatory survey authority. This is also a facet of the Defense Production Act, but not Title I nor Title III, rather Title VII. It's 705, specifically for those of you who are not well acquainted with the DPA and are anxious to do due diligence subsequent to this engagement. But there is a role for virtually all of you in this equity. We conduct mandatory surveys typically on behalf of partner agencies, and in this case, ASPR has exercised the vision to partner and leverage our authorities to ensure that they have not only snapshots of industrial-based behavior today in certain segments of industrial-based, say influenza vaccine, for example, or API, but are able to engage our portfolio as a department to ensure that they're receiving the most optimized policy counsel and programmatic advice. We have this convening power as a department, which is rather extraordinary. My bureau doesn't buy medicine. Our role is largely a non-proliferation equity, as the lawyers in the audience likely know. It's foreign policy, it's export controls. That's kind of our core competency as a bureau. But we also occupy this extraordinary industrial-based supply chain resiliency lane, this nexus, if you will, where we promote economic security, but not at the expense of national security. So it's this really tight line, which as a country, we've increasingly been forced to tightrope walk of late. And working with ASPR and the White House and many others over the years, we've been able to service and essentially fill the gaps with regards to knowledge. So bringing a lot of visibility into supply chains that typically maybe consultancies or the Census Bureau have been able to afford constituencies really high level sort of trend information, but never data of an audit level, if you will. The surveys that we develop and deploy are extremely high fidelity, typically involving thousands of nodes. Many of you will be compelled under mandate to complete one of these surveys. Specific to active pharmaceutical ingredients, you may want to leave me your business card before I leave the room today, because you're really participating, and I'm here today at this very unique stage in this particular 2-year study cycle on active pharmaceutical ingredients, where we're developing the survey now, and we need your help to ensure that the questions we're asking are the right questions, and that we represent your intelligence as it relates to scrim behavior and choke points. We have a method that's highly collaborative. We also do field tests of our instruments. So some of you will anticipate engagements where, if amenable, we can come visit you, potentially with professionals and SMEs from ASPR, to ensure that we understand your problems so that they're represented in a very concise, deliberative way within the instrument itself, so that when we're deploying it, the data we're collecting makes sense and ensures that ASPR has the most informed intelligence as part of their own decision tree. 2 things to remember, because I can go all day. As it relates to the convening piece, DPA 705 mandatory survey. Okay, so that's a critical takeaway from this discussion. All right, this is the survey guy. 2, Section 232, imports. Yes, we have a trade equity. Typically, that's housed within ITA, Census. Our sister bureaus and agencies are terrific. We work with all of them. But please be mindful that on the national security front, relevant to imports, my team also executes analytics and investigations based on the correlation of imports to national security. So for those of you who are observing foreign dependency at the expense of capacity, what do I mean by that? You are losing competitiveness due to foreign dependency. There are unique opportunities to approach the department with petitions to execute a 232 investigation to achieve some relief if a positive determination is realized. Steel and aluminum are 2 hot cases, as you all no doubt appreciate, that were executed during the Trump administration. We finished one relatively recently on neodymium permanent magnets, a positive finding, and with a healthcare, public health industrial base equity, in particular on the MRI side. So 232, Section 232s, do look into that. I'm happy to entertain questions to that effect during this panel or subsequently. The Section 705 authority, and I'll bring more as the panel evolves.
Great. Thanks, Jason. If you could tip the mic towards Sharon. They're a little finicky. Sorry. So, Sharon, thanks for being with us, and congratulations on assuming the acting role as the Department Supply Chain Coordinator for ASPE. Could you elaborate on the unique problem-solving approaches that HHS ASPE is adopting to ensure supply chain resilience?
Happy to. Thank you. So I'm the relative newcomer to this space. ASPE was designated as the home of the HHS Supply Chain Resilience and Shortage Coordinator just the beginning of this year. And so I'm currently serving in this capacity on an acting role. HHS is focusing on the underlying broad objectives to foster supply chain resilience. First, improving HHS's ability to respond to supply chain disruptions. Second, promoting diversification of supply, both overall redundancy of manufacturing capacity and in the balance of domestic and diversified foreign sourcing. Third, promoting reliable, efficient, and sustainable manufacturing practices, and improving transparency in the supply chain. So I don't want you to be confused by my title and others' titles, Tammy's, Waylon, we've all got supply chain in our title, but my role is really a coordinator. I'm not doing the operational work that they're doing. I'm really relying on their expertise. And my role is to kind of look across HHS, understand what's going well, what isn't going well, where there are gaps in knowledge, in data, in authority, in resources, and try and identify how we can fill those gaps and move forward. So one of our most recent tasks was developing a white paper outlining some of the steps we've taken and proposing some additional activities. The white paper describes a program of collaboration with the private sector to develop and implement a manufacturer resiliency assessment program called MRAP, which is modeled after FDA's QMM framework to identify resilient manufacturing. This would be paired with a hospital resilient supply program, which would provide enhanced Medicare payments for hospitals who purchase from resilient manufacturers. Now, this is a proposal. It's not yet in law, but it's one of the things that we think is an innovative approach to helping further our supply chain resilience. And while this approach is initially focused on generic sterile injectables, it is an example of the type of policy proposal that we're working on to enhance transparency into the market, link purchasing and payment decisions to supply chain resilience practices, and incentivize investments in supply chain resilience and diversification in the supply chain. And we hope, if this is enacted into law, to start expanding this to other drugs and devices as well. Thank you.
Thank you so much. Linda, appreciate the partnership with HIDA and what you've done with us all through the pandemic. Question for you. How does HIDA envision the future supply chain policy in the health industry, and what steps are being taken to realize this vision?
Thank you, Joe. Thanks for the question and the partnership. We greatly appreciate it as well. So before I answer the question, I'll just say we're thrilled and honored to be on the panel. So I thank you. And if you don't know HIDA, HIDA is the Trade Association for Medical Product Distributors. So PPE, testing supplies, all those sorts of things that we've been talking today is going through our supply chain. And we've got a lot of members in the room and a lot of our manufacturing partners. So I'm only here because they keep coming to the table as well. So thank you to my members who are here, and thanks to all of our federal partners. So to answer the question, I'm going to mention two things. When we think about future and we think about resiliency and we think about what the policy we need to support that is, one thing that we've been collaborating with federal partners on, and it's on our website, is we launched a playbook in the fall, kind of a green, yellow, red traffic protocol. And it was all about how can we collaboratively monitor the supply chain. We talked earlier today about we're genius if we prevent it. I didn't even know that that's Einstein said that, so I don't know if that means I'm genius or not. But it was all about, can we collaborate, monitor, flag potential disruptions for each other, commercial market and federal partners, so that we can better get ahead of any sort of issue in the future. And that is on our website. We just launched that in the fall. We're working on a communications protocol that goes with that, because it's no good to anybody if we're not able to communicate things for potential disruptions, or if there is truly something more catastrophic like a COVID, how do you communicate it in a way that is actionable for everybody who has a stake along the way? So that is, again, on our website. You're welcome to look at that, welcome feedback, because we view that as a living document, and we're going to keep working to improve it. On the policy side, I'm not going to quote Einstein. I'll quote the A-Team, because I love it when a plan comes together. It's perfect timing. We are actually launching a supply chain resiliency roadmap. HIDA is this week, hopefully, if everything lines up internally. If you don't see it this week, it'll be out next week. But what that does is take all of our collective work and experience with federal partners in the commercial market over the last, for me, a lot of this work started with Ebola when I was newer to HIDA and progressed, obviously, through COVID and recent disruptions, because we now care about transportation as well, and kind of put that in together of a roadmap of what does resiliency need for the future, and it has some policy recommendations. It's got 5 main pillars. One around stockpiling, and how can we figure out a better way to rethink some of those stockpiles, and how do we reimagine and maybe partner with the commercial market on that, because I think we learned we can't stockpile our way out of a pandemic, right? That product needs to be rotated and managed. It expires. We talk about the need for a critical buffer of supplies. Tammy, you'll love that we mentioned the critical medical device list in that pillar as a potential opportunity of a sub list, maybe to start with, because not everything would make sense for that sort of action. We talk about transportation and talk about our Fast Pass proposal as a legislation on the Hill that just passed out of the Transportation Committee. It would have DOT in partnership with HHS talk about what kind of process can be created to establish to expedite medical product containers if we ever have the situation that we did during COVID. And then we also talk about diversified sourcing and the need to really think hard on how you sustain a domestic market. It's not just about the seed money, but it's making sure that there is a market demand for that product that we want to make sure is made here or is nearshored. But recognizing that diversity, and there's a global aspect to it too, is important. Not putting all of our eggs in one basket for the most part. And the last pillar is partnerships. So I think when I think about that in the future, it's conversations like this. I know a lot of you, as I look around the room, are other associations, and I'm sure you all have meetings, just like HIDA does. We invite our federal partners to come. We have great conversations, and I think that conversation and that relationship building is the future to keep going with that information sharing that we've already got established and keeping that trust going. And that's on all of us to keep being good stewards of that trusted partnership that I think has really developed and grown stronger during COVID. So we have one pillar devoted to partnerships. So, thanks.
Thank you. Sean. I don't even know where to start. Like with you and Tim in the same room together, like it should come with it's a great reunion that needs to come with a PTSD warning, right? So this is great. So really appreciate you being here. Really appreciate your continued work at the White House on these critical supply chain issues. The partnership's been incredible. I mean, I can't say that enough. I can't, thank the current administration, the leadership and guidance, and partnership that you've had all along the way with us to ensure that we kept Americans safe and healthy as much as we could through this pandemic. So given your role right now as this whole government supply chain coordinator, what would you say our greatest successes were during the recent response efforts? And what's keeping you up at night for the next one?
Well, thank you, Joe, and good to see many familiar faces in the room. To introduce myself, I'm Sean Christensen. I'm currently at the National Economic Council in the White House, where I work on industrial policy and supply chains. We're really focused on the resilience of the nation's critical supply chains, those supply chains essential for our national security, our economic security, and public health, which of course include our medical supply chains. And as alluded before I stepped in that role, I spent 2 years with many people in this room working on the COVID response team in the White House on our supply chain resilience. I think, as you alluded, Joe, something that's been very clear from day one of the administration is the importance of supply chains for the president, with 2 major executive orders focused on supply chains just in the first few weeks in office, right during that time where the pandemic, the COVID-19 pandemic, was exposing just how many vulnerabilities existed in our supply chains. And whether that was an insufficient level of domestic production and an over-reliance on China and other partners for critical items, whether that's some broader market failures that had existed before the pandemic that was really undermining maybe the resilience of our supply chains and not investing the capital and other resources that needed to be there to make sure that goods could be there in response to a demand shock or a supply shock. And some challenges of transparency, where some of the most critical items in our supply chains were moving around, and we didn't have as government, as private sector partners, as hospitals and consumers of these goods, the visibility that we needed into the resilience or lack thereof. And since then, it's really refreshing just to be here and remark that thanks to the work with private sector partners across, as well as partners at all level of government, the progress that we've made over the last 3+ years, whether that's restoring domestic manufacturing in the medical space through investments in onshoring, as well as private investments as well, whether that's increasing the transparency of our supply chains through a lot of innovative partnerships between public and private data sharing, and some of the more creative policy solutions that have been implemented to really just improve the resilience at all levels of the supply chain. As the president spoke at an event in November last year, this progress broadly coming out of the pandemic and increasing the resilience of our supply chains has been really important for the average American. That's lowering costs for American families. It's the improvement of our supply chains has helped bring down inflation, as economists have shown. And it's increased American manufacturing, American workers, and that's large businesses and small businesses. But I think the impact in this supply chain is really important to me because of my past work, and important, of course, to many of you all, just because of what those terms of supply chain resilience and lowering costs really means for critical medical supplies. That meant, of course, for some products, just simply lowering the cost of healthcare, making it more accessible. For others, other products, it meant keeping our healthcare workers safe and having reliable access to the equipment they need. And for Americans, it just means having general access and confidence that they can have affordable, reliable care that they need on a day-to-day basis or in times of emergency. And one thing that my team has been focused on recently, and with that event with the president in November, is ensuring that the focus that we have really built towards supply chain resilience in this sector in particular over the last several years is not temporary. The president made really clear that when he launched his new Council on Supply Chain Resilience, that we are really focused on embedding an enduring capability across the U.S. government and in partnership with all of our external partners on industrial policy and supply chain resilience for years to come. While hopefully supply chains aren't the dinner table conversation or living room conversation that they became for many Americans in 2020 or 2021, we want them to have confidence that the experts, government, and we are continuing to focus on this every day so that they don't have to worry about the medicine and things that they need. And that's been very important. Of course, some of the highlights today have been focused on the public health and pandemic supply chains, PPE, vaccines, diagnostics. But we've also seen, as my colleague Sharon alluded to, and as many of you all know, how important broader drug shortages and access to medicines has been as well. And that's a problem that predated the pandemic. And so that is something that our team has really been focused on, of how can we make sure to embed the progress that we've made on some of the highest priority items during the pandemic, but also apply some of those same concepts and tools to making sure that all essential critical medical products have resilient supply chains. And I think to answer your original question, Joe, in terms of the things that I think are the biggest successes from our work is just how much process, tools, capabilities were able to be built during times of crisis. That classic term about building planes as people were flying them. Many planes built of different shapes and many evolutions of those designs and processes as either crises ebbed and flowed, or as we had new crises enter the picture. And in terms of what's keeping me up at night, or what keeps me up at night, and why I still continue to focus on industrial policy in my current role at the White House, is maybe a fear of just losing some of the capabilities that we've all built for the next crisis. I think as you alluded, and as many of the people in here worked on, we are the people who saw how bad things could be and really dove into finding solutions and know what needs to change. And some of that change is very difficult, totally transforming the way that markets operate, such that resilience is a focus. And whether that's buying more things domestically, continuing or making permanent some of the data sharing and collaboration and engagement that we all do. Something that I and my team are really focused on, or just making sure that we continue to focus on those oftentimes hard solutions, so that we can confidently say that we have come out of the other side of this period of learning and resilience in a better state, because we certainly owe that to the American people and to ourselves for just all the work that has gone into resilience over the past few years.
And anything you want to say about what's keeping you up at night?
I think that was what was keeping me up at night, is just that we, collectively, that we, continue to focus on embedding some of the shorter term, changes that we've made so that they're fixed for the long term.
Great.
Yeah.
Thank you, Sean. All right. So this is for all panelists. In your opinion, what improvements can be made, current system, to better coordinate supply chain activities across different departments? Don't all jump in at once.
I'll jump first, because I wanted to address just a couple of things that Sean said too, and just build on that really quickly. First of all, my family would be really excited if supply chain wasn't a topic of conversation every night at the dinner table, let me just say. But I'm afraid they're kind of stuck with that probably for a while. You know, I do want to just comment on what Sean said about we've learned so much and we have put so many processes in place that I do think it's really important that we do continue to build on those, and I alluded to that earlier. But I do want to point out too that there were vulnerabilities in place before the public health emergency that were exposed during the public health emergency. And early on in the public health emergency, I'll just put a good punch in for devices. What was short at the beginning of the public health emergency. So we saw devices that were needed that were not available, and the acute increase in demand. And so I do want to make sure that we continue to maintain a focus on devices because number one, that's my job. And number two, you know, we do continue to have concerns around vulnerabilities that, just like drugs, need to be addressed in devices as well. So just wanted to plug that as well. As far as your question, now I'll get to your question. Your question is, you know, I think it was how can we better coordinate and the activities across the different departments and data. I mean, I think, you know, we are all kind of built. So my office was stood up during the public health emergency. You guys you have the supply chain control tower, and we've, you know, begun formalizing some of these communications. We need to continue to figure out best practices for sharing information and bringing the data that we do have to the table to address the vulnerabilities and see the vulnerabilities early on. And we have data that when working together, we would be able to utilize that to inform those investments if so needed, right? And then also to inform the policies and the transparency that Sean mentioned, having that transparency around the supply chain, which quite frankly, we didn't have early on, but we've really started to build that transparency. I know we have internal data sources that we use. There's no one place for all this data, but we have internal data sources. We bring in external data sources. We marry that together and then create products that give us an idea of market assessment, numbers of manufacturers for a specific types of device, et cetera. And so all of that information really goes into informing about the CMDL, which Linda also mentioned too. So as we're starting to look at potential vulnerable devices or pharmaceuticals, being able to focus and scope our work in our data and our sharing to address those most critical devices as well. So I'll stop there for right now. Yeah.
A few. As a practical short answer, mandatory details as a condition for promotion between departments. The most astute, engaged policy minds and intellects I've had in my 20-year tenure with Uncle Sam have been those who've had tenures across the bureaucracy. Point two, lessons learned from other industrial-based segments. I used to have a colleague, no longer with us, God rest his soul, who was the author of this report on foreign sourcing of medical devices, including PPE, ventilators, came out in 2010. Along with a separate report that we co-authored on counterfeit electronics. You have a lot of lessons learned in different technology spaces, different departments, different bureaucracies, which can be applied to public health. Before cybersecurity became the gorilla in the room, it was all about part pedigree, counterfeit electronics, counterfeit material. The Navy showed up at our shop because F-18s were falling from the sky due to counterfeit boards. It was DLA's responsibility to administer through the depots all the logistics and parts replacement and testing. But the Navy had the courage to come to Commerce and say, okay, we appreciate that DLA has this responsibility. It's their domain, but we need more data and we need to understand our suppliers. So they came to us. We did a vast supply chain best practices assessment on counterfeit electronics. In parallel, through that awareness, other bureaucracies with relevant authorities began to do their jobs. So sometimes it's about taking action, having courage, implementing programs, as Asper has done on the study front, which compels others to do their job. And it's not so much about flooding the gates with new money. It's appreciating the unfunded programs that are already on the books, the intellects and SMEs behind them who are waiting for something to do.
I'd like to echo those thoughts. I think, understanding and sharing data across departments will be really important. Understanding best practices and lessons learned across industries and across products, and understanding markets holistically a little bit better. ASPE is traditionally, a research and analysis place, and we do a lot of analysis on the medical product market and trying to map the different players in the market and understand the interactions between them. And I think sharing this knowledge across the federal government with others that are doing this kind of analytic work and sharing data and expertise across the government is really critical to knowing where we have gaps or where we might try new tools in the toolbox.
I'll be super quick because I want to kind of say ditto. It's institutionalizing that knowledge, right? We would be all doing ourselves and our people coming behind us a disservice if we didn't pass that on. Because for two, like our fast pass legislation that I mentioned earlier was because of the work with Sean and Tim on expediting medical supply containers off of all of the ships that were anchored off of the West Coast. We call it fast pass, maybe we should have called it the Sean and Tim bill in hindsight. But like that's a big lesson from us, right? And that is hey, let's not just forget that. Let's actually get a process. And as an association, that means you want legislation and you want to move that forward. But let's take that and use that and then institutionalize it. And the second thing is, I think it's been kind of mentioned, is the control tower. That is an incredible amount of, I'm proud of our distributors. There's 8 distributors of, I don't remember how many are total doing the control tower, submitting data on PPE and other products. And that we don't want that to go away in terms of that knowledge base and that institutional structure, right? So I think the ability and the partnership and the trust that's built out has allowed some of those programs to get stood up during COVID. I don't know if that would have happened 10 years ago. And I think we'd be doing ourselves a big disservice if we didn't institutionalize some of that knowledge and that work.
And I'll just add, I think something that we're doing in medical supply chains, but across supply chains, is really trying to, I think, both standardize some of the ways that we think about resilience and vulnerability, be clearer about the problems that we're trying to solve, and then the tools and solutions needed to solve them. And I think, just to call attention in the drug shortages space, there's a lot of incredible work that goes on, at all stages of the value chain, from the, pharmacists making calls across town to, the great staff and FDA trying to understand shortages. And it's a very important, very important work. But with this white paper that Sharon mentioned on addressing drug shortages, one of the things that the department really set out to do was to clearly lay out at least HHS's understanding of what are the specific issues and problems causing the lack of resilience here that drives drug shortages, and what are some potential solutions that that could some are quite transformative to address those. And I think at this phase and a lot of the resilience work, I think that we're focused on those analyses are really important, such that we are really trying to focus on the specific issues and problems and the specific tools that we have available to solve. And of course, that is all requires a lot of collaboration and iteration with industry. At least, many of these resilience issues really require actions up and down the supply chain, up and down the value chain to embed resilience. And I think having those, really, specific, tactical, solution-oriented conversations is what's going to drive the ball forward even further.
Tests to the American public, and then they pledged 500 million more, I think, the next day. Right, Tim? We were all collectively on that same call where Tim and Sean broke the news to us, We had the natural human reaction that was somewhere between tossing our laptop through the window and coughing up blood. And then we steeled ourselves and we said, you know what? Let's get it done. And it was our partnerships with CDRH, with NIH RADx, with HCOR, with the Department of Defense, specifically DLA, DCMA, and our other partners at GSA that stood up this little mini Manhattan Project team with industry, a number of you in the room included, to basically deliver that capability for America. And what I want to say is we weren't just able to deliver that amount on time. To date, this team collectively has delivered more than 1.8 billion diagnostic devices to the public. So I just want to say thank you, round of applause.